Okay, we might get started. So hello everyone and welcome. My name's Edwina Duffy and I'm a Healthy Tasmania Project Officer at Public Health Services in the Department of Health. Thank you for joining today's session about our Step Forward and Healthy Focus grants. It's great to see lots of familiar names and faces as well as lots of new ones joining us, and we hope you're warm and dry wherever you are today. I'd like to acknowledge the Aboriginal people of Tasmania Lutruwita as the traditional custodians of the land on which we live, work and play, and pay respect to Aboriginal elders past and present, particularly any joining us today. Aboriginal people's traditional lifestyle promoted physical and emotional health and well-being, centred around country, kin, community and spirituality. And we recognise that Aboriginal people are the knowledge holders and provide best practice in promoting health and well-being for Aboriginal people. We acknowledge and learn from the ongoing work of Aboriginal organisations in ensuring continued health and wellness, and we commit to working in partnership with Aboriginal health leaders now and into the future to improve health and well-being. Before we kick off today, I'll just cover a few housekeeping items. We are recording today's session and it will be available on our webpage after today. And because of the large audience we've got today, we have muted your microphones, but we'd love to see your faces. So please turn on your camera if that's an option for you today. You can use the chat to say hello and introduce yourself. We do acknowledge that some people may not be able to make it today because of the severe weather that we've had, particularly up in the north and northwest of the state. So when you introduce yourself, if you could also just add which region you're in or where you're dialing in from today, that will just help us be able to see if the weather's impacted our attendance today. The format for today's session is that we'll talk about the grants, the Step Forward and Healthy Focus grants, for about half an hour or the first half of the session, and then we'll have time for questions after that. And because of the number of people we've got joining us today, we'll be using the Q&A function in Teams for questions. It's at the top of your screen. It's just to the right of the chat. So if you have a question, you can just post it in the Q&A. If you see that someone has asked a similar question to what you were thinking about asking, rather than asking it again, you can just like it and give it a thumbs up, and then we can see that that's a popular question or a few people want to ask that type of question. And my colleagues, Brian Spittle and Julie Williams, will be monitoring the Q&A throughout the session. If you do have a question that's quite specific to your organisation or project idea, please do call us or send us an email after this session, and then we can talk it through with you. And now I'd like to introduce Emma Fitzpatrick, the Director of Health Improvement and Partnerships at Public Health Services, to talk a bit about Healthy Tasmania and our grants program, the Healthy Tasmania Fund, more broadly.
Thank you, Edwina, and it's wonderful to see so many people online today, so welcome. A little bit about Healthy Tasmania. So Healthy Tasmania is the 5-year strategic plan, is the government's plan for preventive health in Tasmania. The plan guides preventive health activity across government and with communities and supports people to live healthier lives and participate more fully in daily life. Healthy Tasmanians' vision is for all Tasmanians to have the opportunity to live healthy, active lives in communities that support connections to people, place and culture. To achieve this vision, we're working together across all levels of government and the community to address the wider factors that influence health and wellbeing. So the plan covers off on 8 focus areas of health and wellbeing, and these include priority populations, health literacy, mental health and wellbeing, active living, eating well, being smoke-free, reducing harmful alcohol use, and climate change and health. We apply an equity lens to our work through our actions, and through our actions we are working towards a healthier population, greater equity of health outcomes across the community, livable, vibrant and healthy places, greater social connections. So the plan is available on our website and we'll put a link to it in the chat for you. So the Healthy Tasmania Fund is a grants program that supports community action on health and wellbeing. It supports the work of local government and community sector organisations who are really best placed to know their community's needs and priorities. There are 4 grant streams: our Step Forward, Healthy Focus, Lift Local and Healthy Together. And we also partner with Relationships Australia, Tasmania for our Neighbours Everyday community grants. The aim of the funding model is to improve health and wellbeing by better supporting communities to create change. And there's a mix of competitive and non-competitive funding and capacity building activities to respond to community needs. Grant streams have simple applications and reporting processes to help support organisations along the way. So measuring our progress is important, and we want to understand if we're making a difference and to identify areas where we may need to target more action. The Menzies Institute for Medical Research at the University of Tasmania are evaluating our grants as part of the Healthy Tasmania Research and Evaluation Framework. Menzies will share their findings through a series of reports, with the next report scheduled for later this year. We will share the links to the Healthy Tasmania Research and Evaluation Framework and baseline report in the chat. And this is something that we launched when we launched the funding model in 2022 through our evaluation. We gained the following insights. Grants have enabled communities to respond to recently identified needs. Grants have helped to build and strengthen partnerships and collaboration. Organisations are using their funding to plan, test ideas and build evidence for future action and investment. And the different grant streams have enabled a wider range of councils, community and grassroots organisations to access funding, which is fantastic. So we're really pleased to announce our next rounds of Step Forward and Healthy Focus grants are now open. And I'd really like to hand over now to Morgan Kent, who will talk to you further about the Step Forward grants. Thank you.
Thanks so much, Emma. Thanks for that overview of Healthy Tasmania and the fund. So let's start off today's session talking about Step Forward grants. So these are our $5,000 grants up to $5,000 from a total funding pool of $150,000. The intent of Step Forward is that they are quick and easy to apply for, and they can be for a wide range of things that support community health and wellbeing. So they could be for activities like building capacity in your organisation, so some training or skill development for staff or volunteers, or they might be for physical resources or equipment. Most importantly, Step Forward grants are for preventive health projects, equipment or activities. So what does preventive health mean? So preventive health is the term for activities that help promote and maintain health and wellbeing. And it means that we want to fund community projects or activities that keep people healthy and well rather than treating illness. So to learn more about preventive health, read the Healthy Tasmania 5-year strategic plan, and you might look at the list of previous applicants to see the type of projects that we fund, as well as looking through the Healthy Tasmania report for years 1 and 2 for inspiration and ideas on types of projects we will fund.
Morgan, sorry to interrupt you, Morgan. It's just Edwina here. We've just got a comment in the chat about would it be possible to just speak a bit slower, if that's possible?
Slower, absolutely. Okay, so guidelines for Step Forward are on our website, and you can also find a downloadable PDF if you scroll right to the bottom of the website. That's for both Step Forward and Healthy Focus. For Step Forward this year, what has changed from the last round is that instead of having batches where we look at one batch and then another batch until the final pool is used up, we're going to do the assessment in one round. So there'll be one chance to apply for a Step Forward grant, and they'll all be assessed at the same time. So the applications are open now. They close on Monday, 23 September. And we'll be letting people know about the outcomes in late October to early November. So if we go to the next slide, it gives us an idea of who can apply. So your organisation needs to be incorporated, not for profit. That includes local government. You need to be doing your project in Tasmania. Community groups and individuals can apply for Step Forward if they are sponsored by an eligible organisation. There are people who can't apply or groups that can't apply. That is for-profit organisations, businesses, consultants, and state or Commonwealth government departments, as well as any education or based organisations. So schools, school associations, parents and friends associations, or libraries. So what can the funding be used for Step Forward? Examples of projects we might fund include small health and wellbeing projects or programs, training for your staff, volunteers or organisation members, health and wellbeing resources, that might be something you're designing or printing, as well as equipment for community health and wellbeing activities. And events may be funded as well. Those are just a few ideas. Other projects may be funded if they meet the criteria. There are things that we won't fund. That includes things that have already been paid for or that have funding from another source. Things that are for treatment or rehabilitation, and first aid equipment. Mental health first aid training is an exception, but first aid training is not covered. So safety equipment, we won't fund, as well as things that might be better suited to a different funding stream, and we can guide you if that is the case, as well as activities that are solely for the promotion of your existing organisation or programs. They need to be looking at community health and wellbeing. So the assessment criteria for Step Forward are that the project has a focus on preventive health activities and it aims to improve community health and wellbeing. There should be a clear link between the project activities and improved community health and wellbeing. There's a need in the community and that your project addresses that need, and that there's not already a similar project in the area. Your organisation should be well placed to deliver the project, and the project should show good value for money. So if you're eligible and your application is accepted on eligibility criteria, it will go to an assessment panel who will get together and decide on the successful applicants based on merit and the assessment criteria. So applications will be accepted and are being accepted through Smarty Grants, our online grants platform. You will need a login to complete an application. If you have a login already, you can use your existing one. Applications will close at 4 p.m. on Monday, 23rd September. So that is in 3 weeks' time. And we have tried to make it quick and easy to apply. So please read the questions and the prompts for the questions, as they will help to guide you on the type of information that we're looking for. And we certainly encourage you to contact us with any questions along the way. You can save and pause your application. So what if we are successful? You will have 6 months to complete your project once the payment comes into your bank account. And we will ask you to submit a short report, including photos. So if you're successful, please take photos along the way, and we'll provide more information about what's required for reporting as you go along. So that's Step Forward in brief. I'll now hand over to Edwina to take you through Healthy Focus grants. If you have any Step Forward questions, you can pop them in the Q&A and we can flag them to answer later. Thanks, Edwina.
Thank you, Morgan. So now I'm going to talk about our Healthy Focus grants. And as Morgan mentioned, the grant guidelines are all available on our website, and you can find a downloadable PDF version of the guidelines at the bottom of each page of the Step Forward and Healthy Focus page under the helpful resources link. So very handy. I recommend downloading the guidelines and having them handy. Healthy Focus grants are from $20,000 up to $100,000, and there's a total funding pool of $1.5 million available. You can apply for any amount between $20,000 and $100,000, and you'll have 2 years to deliver your projects. Grants are for preventive health activities that reduce the barriers to people living a healthy life. Now, Morgan explained earlier a bit what we mean by preventive health activities, and they're activities that help protect, promote, and maintain health and well-being. So there's a focus on preventing rather than treating illness. And we know that some groups of people experience poorer health than the rest of the general population because they face extra barriers. And by barriers, we mean anything that limits people's access to the resources or information or services or care they need to be healthy. And there are many reasons for these barriers, such as social or economic disadvantage, racism or discrimination, or language and access barriers. So improving health outcomes by reducing those unfair and avoidable barriers or improving health equity is a key principle of these grants. And a health equity approach recognises that some groups of people need more support or resources to reduce those barriers and to achieve better health outcomes. And this means targeting activities or targeting interventions and working with those people who are experiencing barriers to health and wellbeing. So that's just unpacked that first dot point a bit. Healthy focus projects must also address one or more of the Healthy Tasmania focus areas. And as Emma mentioned earlier, there are 8 focus areas, and these are priority populations, health literacy, mental health and wellbeing, active living, eating well, smoke-free communities, reducing alcohol harm, and climate change and health. Projects can address more than one focus area because a few of those focus areas overlap. You don't need to address lots of focus areas or all of the focus areas. And in fact, we do suggest that applications may be stronger if they focus on outcomes for 1 or 2 focus areas rather than trying to address lots of the focus areas. The grant guidelines include a summary of what we mean by each focus area and the kinds of activities that we're looking to fund, as well as some useful documents and resources, which also include some data and evidence that might help you plan your project. So grants are also for developing or testing new programs or expanding existing ones. And by that we mean building on or growing or scaling up an existing program or trying it in a different location or taking one element of it that you may want to further test or trial or grow. In terms of what has changed from the last round of grants, not much has changed. Improving health equity was a focus of our last grants round, but this time we've really named it up more clearly as a principle of the grants. The other thing that we've done is provided some more examples of the types of things that we will and won't fund in the grant guidelines to help you better understand if your idea is the right fit for the grant. So now in terms of eligibility, eligibility for Healthy Focus grants is very similar to Step Forward grants. So to be eligible, organisations need to be not-for-profit and incorporated. This includes local government. And you need to have an office, branch, or some kind of presence in Tasmania and be doing your project in Tassie. If your organisation is a not-for-profit, but you are not incorporated, you can apply if your application is sponsored by an eligible organisation. The key difference with Healthy Focus and Step Forward grants is that individuals aren't eligible to apply for Healthy Focus grants, even if they're sponsored by an eligible application. Otherwise, our eligibility is very similar. So for-profit organisations and businesses can't apply, schools associations, child and family learning centres, and libraries and universities can't apply. I just want to flag as well that state or Commonwealth government departments can't apply, and this includes if you're from the Department of Education, Children and Young People, another area of the Department of Health, or from the Tasmanian Health Service. So our guidelines explain in more detail what funding can and can't be used for. We've just got a list here of the types of things that we might fund. So funding can be used for any goods or services that are directly related to your project. So this might be things like short-term staffing, project staffing or subcontractors, capacity building activities, for training or upskilling your staff or volunteers, any activities that might strengthen collaboration across your community or sector, any action research, community consultation or co-design activities, any equipment or materials or other items needed for your project, minor capital works, minor building works or infrastructure, or any expenses for people to participate in your project, especially costs that might help to reduce barriers to participation. So things like travel or childcare costs or paying people with lived experience. These are just some examples. Other activities may be funded if they meet the assessment criteria. There are some things that we won't fund. There is a full list of these in the guidelines. I haven't included them all here, but I do just want to highlight a few of them that do come up quite often when we're dealing with inquiries. So because our grants focus on preventive health, we don't fund clinical or medical services, and that includes treatment or rehabilitation. And we won't fund training or upskilling that's specifically or only for healthcare professionals. We won't fund sporting club activities or equipment that are for normal club activities or what you might be doing as part of your core business. But we may fund some sporting club activities that are outside your normal operations. So that might be, for example, some targeted activities that are helping to reduce barriers for certain groups in your community to join in your sport that haven't participated before. We won't fund activities that have already been paid for or that are already funded by another source, unless what you're proposing to do for this project is clearly different or building on or expanding on those activities. And we won't provide continued funding when another funding source has run out. Again, unless this is, if the activities that you propose are clearly showing how they are building on, expanding, they might be scaling up or trialing something in a new area. So they're a little bit different to what you were doing before. And the last thing I want to flag is that we won't fund upgrades to toilets or change rooms or other facilities unless those upgrades are part of a wider program or engagement strategy and there's a clear link to improving community health and wellbeing. So there were just a few of the ones I wanted to highlight. If you're not sure at all if your project idea falls into one of these categories or or the others listed in the guidelines, please just give us a call or send us an email and we can talk it through with you. And it can be helpful to look at some examples of what we've funded in the past. This slide does list some examples of projects or activities that we may fund based on what we've funded in the past. It's not a limiting list at all. You can also have a look at the list of projects that received funding in the first round of Healthy Focus, and that's available on our website, and I can see Julie's just popped that in the chat. And also our Healthy Tasmania report for years 1 and 2 also has some great stories and projects that we've funded across all of our grant streams that you can take a look at to get an idea of the types of projects we'll fund. Great, so there are 6 assessment criteria for Healthy Focus grants. They are weighted fairly evenly. The guidelines have a lot more information about each criteria, including what we're looking for in applications and what strong applications will demonstrate. There are also some prompt questions that can help you plan your project idea and respond to the questions that are in the application form. I just want to note there's no criteria, there's no individual criteria for health equity. And this is because an equity lens or health equity approach should be applied across all aspects of the project and all criteria. And you will see this reflected in the prompt questions for each of the criteria. People often ask for tips around writing their application, around what makes a good application, or how can I give my project the best chance of being funded. We do have some tips and resources around writing applications in the helpful resources section of the guidelines. So make sure you have a look at that in the guidelines. Another piece of advice that I'd give from the perspective of our grants programs is to understand, to have a really good understanding about what the purpose of the grants is and the types of activities that we're seeking to fund. And you can do this by reading the guidelines, reading about the focus areas, and having a look at some examples. And if you're still not quite sure, please just give us a call and we can have a chat with you. So I'll just give a little quick description of each of the criteria. Project design is about the plan for your project. And strong applications will have a clear and feasible plan, so they'll be realistic and achievable. And they'll also describe how the activities that they're proposing to do will reduce barriers to health and wellbeing. And they'll tell us about the evidence and best practice that they've drawn on to plan the project. Community need is about showing that your project will address a proven or identified need in the community, and strong applications will clearly explain how they've come to understand that need and their proposed response, as well as who they have spoken with. Capacity to deliver is about your organisation's ability to do the project and the other groups or organisations that you'll work with. You can include letters or emails of support as evidence of your partnerships or networks. And again, our guidelines have some tips around what will make a strong letter of support. Ongoing benefits is about the effect or impact of your project and the benefits for your community after the funding period. And this doesn't mean that your project needs to keep running after the money runs out. It means things like the resources that you might develop as part of your project that can be continued to be used after the project, or what evidence or learnings you can use from your project to plan future activities. Measuring change is about the changes or the outcomes you expect for your project and how you're going to measure them, or how you will know you're making a difference. We use the results-based accountability framework, which is based on, or the RBA framework as it's known, and that's based on 3 questions. How much did you do? How well did you do it? And is anyone better off? And strong applications will have clear and achievable outcomes and measures, because if your application is successful, these outcomes and measures that you list in your application will become the measures that you have to report against in your funding agreement. And lastly, value for money is about looking at your proposed activities and the expected outcomes and the amount of funding that you are requesting. So we will ask you for a very rough budget outline, and we would suggest that try to be realistic about what your project will actually cost and what you can achieve with the money you are requesting. Here you can also tell us if you're planning to use any subcontractors or if you have any other funding or other in-kind support. And then lastly, just around assessment, the process that we will go through is that once applications have closed, all applications are checked for eligibility and whether they address at least one of the Healthy Tasmania focus areas and whether the activities are in the scope of the grant. And by this, we mean looking at the list of things that we will and won't fund. And if an application doesn't meet those requirements, it won't progress to the next stage, to the selection panel. We will apply an equity lens to our assessment process, and that means that the selection panel will consider a combination of factors, so the application merit against the selection criteria, as well as the mix and spread of applications across activity types, project types, focus areas, geographical regions, and population groups. I just want to quickly touch on the supporting documents. I know this is always the really dry part of the session and part of the application what you have to provide, but we are government and it is a requirement. So depending on the amount of funding that you're requesting, you will need to provide some supporting documents. So if you're applying for up to $30,000, we just need a certificate of incorporation. If you're applying for more than $30,000, as well as your certificate of incorporation, we also need evidence of some insurances. So we need a certificate of currency showing professional indemnity and public liability insurance. And we need annual reports and audited financial statements for the last 2 years. I will just note as well that if your organisation is a local government, or if you do receive funding from the Department of Health, you don't need to provide these documents. And I will just make a quick note on the insurance as well, because we know that many small organisations may not have the required levels of insurance. So that's $10 million for professional indemnity and $20 million for public liability. And if your organisation doesn't have those required levels of insurance, you can still apply. We just ask you to commit to increasing your insurance if your application is successful. So if your application is successful, you can then increase your levels of insurance, and you'll need to provide us with an updated certificate of currency before we can pay any grant funds. It's a really good idea to get a quote for increasing your insurance before you submit your application as part of your budget planning, because you don't want to get any nasty surprises down the track and find out that the cost of increasing your insurance is more than you expected. And you can actually include the cost of increasing your insurance in your project budget. Okay, so then how do I apply? On Smarty Grants through our online portal, got the link there, and Julie's just popped the link in the chat, thank you. And key dates for Healthy Focus grants. Applications close in 4 weeks' time on Monday, the 30th of September. We will let applicants know by the end of the year. We've put 31st of December, but we'll be letting people know before Christmas, so you don't have to be hanging around between Christmas and New Year. Projects will start on the 1st of March next year, and successful organisations will have up to 2 years to deliver their projects, and they'll finish by February 2027. If your application is successful, you will enter into a funding agreement with the Department of Health, which means you'll need to sign and return a funding agreement before we pay any grant funds. And those funding agreements will start on the 1st of March next year. There are reporting requirements for the grants around your project delivery, as well as some reporting requirements for financial and quality and safety. And these are explained in the guidelines in more detail. So I think that's enough. Sorry, we've given you a lot of information there. So I'll hand back over to Morgan now.
Thanks, Edwina. So that was an overview of both of the grant streams. And a lot of information to take in. We really recommend reading the guidelines, so going onto the website, reading through all of the information, and you can, of course, contact us for any questions. So we're now going to move into the Q&A section of our info session today. So how we will run the Q&A is we have the question and answer function in Teams. So you'll see a little icon that says Q&A on the top line of your Teams. Click on that and you'll see a menu pop up on the right-hand side. There's already some questions there. What we'll do is any questions that have lots of likes or comments under them will be where we'll go first. So if someone has asked a question similar to what you would like to know, click on the thumbs up button under that question, and that will tell us that there's a few people with a similar question. If your question is specific to your organisation or your project and it's a little bit more fine detail, we might leave it until after the session and we'll contact you to discuss it one-on-one. So you may get a response from us to your question inviting you to leave your name, email and contact details for us to follow up in more detail one-on-one. We'll focus on questions that are relevant to the whole group. So let's get started. I'll hand over to my colleague Brian, who's actually been monitoring the Q&A, and we'll read out a few questions for both Edwina and I, although I can see that Julie has her hand up. Let's throw to you first, Julie.
Thanks, Morgan. Just back in the chat bar, we've got a few people who are saying that the Q&A haven't been set up for this meeting. And I'm not sure if anyone else, somebody else, Sue Ryan's got the same message. If that's the case, then maybe some people might still use the chat bar, and I'll monitor that, and then you'll clearly, show which questions are on the Q&A.
Yep, that sounds like a plan. So Brian, over to you to kick off with questions.
Thanks, Morgan. Pardon me. Got some great questions coming in here. So the first one I'm going to go to is from Katie Pennington. Pardon me. And the question is, can an organisation submit more than one application?
Sure, I can answer that one if you like. Now, this will be the case for both Step Forward and Healthy Focus, is that technically, yes, you can submit more than one application. The projects that you're applying for would need to be different. So there would need to be two discrete projects. And we very much recommend, rather than going for quantity, that you go for quality. So you put all your energy and focus into one really good high quality application is going to be the best way to use your time and resources. And having more than one application in for either of the grant streams doesn't make your chances higher of receiving a grant fund. Anything to add, Edwina?
No, I think you've covered it beautifully there. Thanks, Morgan.
Great. Thanks, Morgan. And let's have a look here. Answer that one. Might just work my way down from the top. It's a bit hard to keep up with the movement in the chat, but that's all right. It's good. So the next question I'll go to is from Kim Parker, pardon me. Have past grant approvals supported delivering programs in state schools?
So is that question asking about delivery of projects in schools? I can respond to that one. So schools are not eligible to apply for grants, or schools associations or parents and friends associations, but schools can certainly be part of a network or partnership where projects are delivered. So it may be that an organisation that is eligible for funding applies for a grant, and a school is part of the network or partnership, and project activities could be delivered in the school as part of that project.
All right, thanks, Edwina. So I'm pin that one. We got one from Jamie Bladel, pardon me if I've got that wrong. What is the policy on partner funding?
Oh, could I ask a follow-up question? Jamie, what do you mean by partner funding? If that's in terms of getting funding from other sources to do your project,
So Jamie, you could raise your hand and then I'll be able to enable your microphone if you wanted to provide a bit more information.
Morgan, you've just skipped onto mute there yourself.
Sorry, Jamie. I've just allowed your mic, but you would need to turn it on yourself on your end as well. No. Yep, there you go. We can hear you.
Okay, thanks. Yeah, sorry, my chat's not working, so I don't know why I couldn't introduce myself earlier, but the question is, when cobbling together a community project through grant funding and sponsorship, there's often multiple funders for the same project. Now, it's not difficult to align the different funding streams with different aspects of a project, but sometimes that becomes a little arbitrary and there are crossovers. So, for example, if you're looking for philanthropic sponsorship as well for your charity, they won't fund you at all unless it's funded by somebody else. And it's the same with arts funding. They will partner fund. So you get one, Creative Australia are good at going for their first, as the first funder, and then Arts Tasmania will fund you if you can prove that you got 50% funding from another funding source. So I'm wondering what the Healthy Tasmania's policy is on having multiple funding sources, because these projects always cost more than you're able to apply to one single funding body for.
Thanks, Jamie, for clarifying that. We don't require partner funding for our grants. You can still apply for grant funding if you have other funding sources to deliver similar activities, perhaps that are contributing to the same overall outcomes. What we would suggest, though, is that the activities that you're seeking funding for through a Healthy Tasmania Fund grant are different or build on or expand on what you are seeking funding for or what you have funding for from your other funders. So hopefully that made sense. So you don't need to have partner funding for us. You can apply for funding under our grants if you have other funding sources, but not for doing exactly the same activities. And you can explain that in your application. There'll be opportunity for in Healthy Focus to explain that in your application.
Great. Thanks for that, Edwina. Let's see what we've got here. Apologies, I was trying to reply to one and I've lost my little spot.
Oh, no.
But that's okay. We've got one here from Kerry Hall, and Kerry would like to know, we are a registered charity, ACNC, but a company limited by guarantee, not incorporated association. Are we eligible?
Yes. So any not-for-profits that are a company limited by guarantee are also eligible to apply. And you can attach the certificate that you receive as part of your application.
Right. Thanks for that.
I'll jump in here, Brian, while you're scanning through. There's one here with 3 likes from Andrea Romero. Would programs that are currently funded by this grant in previous rounds, would they be considered if proven success is explained?
Sure, I can jump in and answer that one. So any programs that currently receive funding through our grants can be eligible to apply, are eligible to apply. What we would advise, though, is that you would need to explain how your proposed activities for this grant application, build on or expand what you're doing under your current grant. So you can definitely explain in your application the proven success or what you have learnt from running this particular project. And you may, for example, highlight some of the things that you've learnt or the evidence base that you've built and why it is that you need to be targeting your activities to continue that or build on that or do something differently.
Fantastic. Got one that's just come in here from Sally Castle. I came in just as you were explaining and it wasn't clear. Did you say that a national organisation would need a bricks and mortar office in Tasmania to be eligible to apply? We don't have offices anywhere.
So for organisations to apply, their project activities need to be occurring in Tasmania. So, and you'd need to demonstrate that you've got a presence within Tasmania. And so, yeah, a bricks and mortar office, no, but a presence and functioning organisation who reaches out to Tasmania, yes.
Excellent. Thanks, Morgan. I've got another one here from Julian. So we are the TUSA Social Dance Society, a student society affiliated with the Tasmanian University Student Association. Pardon me. We were wondering if we are still eligible for Step Forward grants. We are a registered not-for-profit organisation, but weren't sure if being a student society impacts our eligibility.
Good question, Julian. We generally talk about school associations and schools and universities being a no, but we couldn't take that question on notice as well to make sure that your
I know that TUSA has we have funded TUSA.
Yes, exactly.
Yeah. And we'll take it on notice, and it may be that it has to be sponsored by TUSA.
That's right.
Yeah.
Exactly. Yeah. So what we'll do is perhaps follow up on that one to make sure that it's clear how you would have to apply and who would have to make the application in order for the project to be eligible. So perhaps if you could follow up with your name and email address underneath your question, that would be fantastic. Thanks.
Morgan. Okay, we've got another one here from Elizabeth Harberg. Will you pay for salaries of existing, pardon me, salaried project delivery staff? Also, will you cover overheads associated with the project?
So thanks, Elizabeth. It depends a little bit. So you can use some funding for staff, but not for ongoing beyond like continued staff salaries. If you were, say, for example, contracting someone to provide a program or a project that none of your staff could deliver, then that could be covered. Overheads associated with the project will vary depending on what that is. Probably the most common question we get is about travel allowance and use of cars and things like that. So again, have a look at the FAQs to make sure that we haven't answered the specific overheads that you're talking about and staff. But I'll throw to Edwina to see if she's got anything to add in terms of Healthy Focus specific.
No, I don't think so. No, it's a good question about overheads. I don't know if that's come up before. So we might just need to take that one on notice and just have a more detailed read through our guidelines and check. Unless, Julie, you had anything to add to that. Otherwise, we can get back with a firm answer.
Yeah, I do believe overheads that are specifically for attributable to the project is included, but we can confirm that. Oh, right. Brian, I've got one. I'll jump in with one if give you a bit of breathing space, because that whole definition of preventive versus treatment. So we've got one here from Carly Fountain for the Healthy Grants program. If treatment is regarded as being preventative and delivered by allied health professionals as opposed to rehabilitation, will that be considered as eligible?
So there'd be a couple of instances where it might be considered eligible as part of the project. For example, if you were running a community group that was providing physical activity for preventive health and wellbeing purposes, and that involved screening by a allied health professional for participants before they joined in the session, then yes, that would be appropriate. But if it was purely a activity that was for only people who have a specific existing health condition, then that would probably not be eligible. So hopefully that gives a bit more context. Julie's got her hand up as well.
Not in relation to that answer. That was great. Just to let you know that we've got 10 minutes to go. I think we're doing quite well getting through some of these questions, but I'll hand over to Brian in a minute. But if you haven't already put your questions somewhere, maybe let us know, put it in again or like it again, and we'll just we'll try and get through everything.
Thanks, Julie. I might just add to Morgan's response to that question as well. That's a really good example where it'd be great to just give us a call or send us an email and we can talk it through with you a bit more.
Great, thanks, Edwina. We've got another great question here from Rebecca Free. Can either the Step Forward or Healthy Focus grants be used for healthy or quality end of life as well, too?
That's a really interesting question, Rebecca. I'm looking at Edwina, I'm thinking we're both nodding and thinking, and Julie's got her hand up. That's a very interesting one.
Not for any treatment or health service delivery, but certainly to think about mental health and wellbeing as a focus area, maybe projects around looking at challenging attitudes or norms, or thinking about social inclusion. So some of those aspects of preventive health would equally apply with healthy dying. Yeah.
And just to add to yours, Julie, I'm just thinking in terms of health literacy and equity, that, if there was certain activities related to that around end-of-life care, then possibly, yeah. Great question.
Yeah, good. And I might just add to that as well, in terms of Healthy Focus grants, it's also about looking at the criteria, at the assessment criteria, and thinking about how your project or activities address those criteria or your responses to those questions. So when you're thinking about your project idea, think about that as well.
Fantastic. Thanks for that. We've got a question here from Alicia Perry. Can local councils sponsor multiple applications as the eligible party and submit their own application?
Yes, in a nutshell, yes.
Excellent. We've got a question here from Suzanne Leeson. We're working on a project to create a wellbeing space for our staff in one of our offices. Its design is to enable our staff to disconnect from work, to connect with each other and with wellness holistically, looking at prevention, collaboration, education, and choice of wellness to support our people in being fit for life and fit for work. Is this a project that would be considered under the Healthy Focus grant?
Good question. I'd say yes, because we do talk about projects that promote workplace health and wellbeing. But again, that might be one that would be great to just get in touch with us and have a chat a bit more about the types of activities, the type of workplace. Sorry, I completely missed your name and organisation at the beginning, Brian, when you were asking the question.
Susan Leeson,
and yeah, so that would be another great one to have a chat with us about, just to, think about who it is that you're working with and that you are addressing all the criteria.
I've got a quick one that has been up there for a while, and I think we keep ignoring it, but are cooperatives eligible to apply? Our structure is a non-distributing cooperative, which essentially means we run as a not-for-profit, returning all profits to the mission of the organisation. When you put in an ABN into Smarty Grants, it will show cooperative.
That's a good question. That's one we might just need to check with our grants team in terms of the organisational structure. And if it was a case that you weren't eligible to apply directly, it may be a case that your application can be sponsored by an eligible organisation. So unless Morgan, you wanted to add to anything, I'm trying to think if we've had a cooperative apply or inquire before, and I can't recall off the top of my head.
No, me either. I think that would be one that we would take to our grants team to double check. So
Great.
we can update you. Yes, thanks, Julie. Please pop your contact details in the chat under your comment, and we'll follow up. And we'll also perhaps add that to our FAQs on the website when we have an answer.
Awesome.
We like questions we haven't come across before. It makes it interesting.
All right. I've got another question here from Carly Fountain. For the Healthy Grants Program, if treatment is regarded as being preventative as opposed to rehabilitation, will that be considered as eligible?
I think that would be a case where you'd probably need to contact us and have a bit of a chat about your project activities and what the type of project and activities you're planning to do.
Right, thanks for that. And we've got, we've got one here from Lindsay Lipson. Does vaping fit with the smoke-free communities?
Yes. Oh, I answered that one in the chat.
Apologies.
Yes, it's definitely, we want to reduce the use of tobacco and related products, and the related products is about vaping. Yeah.
Great. I can't see any. If we haven't answered your question in the chat, please let me know. It looks like
we've got probably running out of time anyway. I think we've got 3 more minutes. One quick question here. Can I please confirm if I'm currently receiving funding from the Department of Health for a project, I don't need to provide all the additional information requested?
I can clarify that one. So if you receive funding from the Department of Health, that's not a grant, not grant funding. You don't need to provide the additional documentation. So if you have a multi-year funding agreement with the Department of Health, if the funding that you receive from the department is a grant, so a previous step forward or a Healthy Focus grant, you do need to provide the information, and that's explained in the guidelines. Thank you.
Just on that, Julie, we did have a related question in the chat that was about whether you could apply if you have received a grant in the past, which is a common one. So again, check our FAQs. Yes, you can apply. What you would need to do is demonstrate that the new funding you're applying for is different to the activities that you have previously been funded for, or that it is growing or expanding or moving to a target a different priority population in the follow-up funding. The other thing to note there is that if you have outstanding reporting requirements that are overdue with us from your existing or previous grant rounds, you wouldn't be eligible to apply until those were completed.
Looks like we got one final question in the chat from Andrea Romero. Can one organisation apply for multiple projects in different streams, considering they may be auspicing pardon me, to individuals or community groups, hence different projects?
Yes. So one organisation may apply for a step forward and a Healthy Focus grant. in this application period. Probably that's come to the end of our time. We have 1 minute remaining. So as we've said before, anything that we didn't get to today, if you're very keen on us following up on, make sure you've popped your contact details underneath your comment in the chat, and we will endeavour to get back to you. Your other option is to contact us via email, as Mirella has popped up on the screen just now, or phone. And do have a look at our website. There is a lot of information and a lot of FAQs, so very likely that your question may have even been answered already. So thank you everybody for your time and your questions, and we look forward to seeing all of your applications coming in over the coming weeks and getting to chat with you all about your projects. So we will close now. Thanks everybody for attending.